Welcome to today's Explainer. We're stepping right into the high-stakes environment of the operating room, a place where, let's be honest, time and sterility are literally matters of life and death. Now, when we think of an OR, we usually picture the brilliant surgeons or that flashy cutting-edge tech, right? But today, we're zooming in on the absolute most crucial layer of defense. It's something used in every single procedure, every single day, to make sure those medical miracles happen safely.
So what is the most critical yet overlooked tool in an operating room? I'll give you a second. Got a guess? While the TV medical dramas always focus on the scalpel or the robotic arms or the multi-million-dollar MRI machines, we're asking a totally different question today. We're looking at the physical, fundamental barriers that actually make surgery survivable. Today, we're unpacking the hidden logistics behind every successful surgery and exactly why sterile drapes matter daily.
Here is our roadmap for this micro to macro journey. We'll start with the unseen daily shield. Look at the 3-zone protocol. Unpack a premium kit, discuss precision for every procedure, and finally, map out total hospital floor plan coverage. Let's dive in.
Part 1. The unseen daily shield. Okay, so let's start with the immediate surgical reality. In the super fast-paced environment of an OR, a single missing item can delay a crucial procedure, and a microscopic gap in sterility, well, that can literally be fatal. So the drapes isolating a patient aren't just simple cloth, not at all. They are a deeply engineered daily shield that actively repels invisible threats. Think of them as high-tech armor. They're manufactured using advanced polymers designed to be completely impermeable to fluids and bacteria. They are the absolute bedrock that makes modern medicine possible. Without this unseen armor, every single surgical intervention would just be a massive gamble.
Part 2. The 3-zone protocol. To really understand how this daily shield works, we have to look at the exact science of infection control. A 100% sterile guarantee doesn't just happen by accident, and you certainly can't base it on hope. It's actually structured in this strict, bullseye-like diagram of 3 distinct layers. This ensures absolutely nothing is left to chance. By engineering the environment into these clear, defined zones, hospitals can systematically eliminate the risk of cross-contamination before the surgeon even makes the first incision. This is where the engineering gets incredibly precise. First, you carefully isolate the patient right in the center. That's Zone 1, using specialized PLD sheets. Now, these aren't just basic covers. They actually adhere directly to the skin, creating a targeted barrier right at the surgical site. Then, you step out to Zone 2, protecting the hardworking doctors and nurses with reinforced gowns. These gowns give them a breathable but impenetrable barrier, so the team can focus under all that intense pressure. Finally, you safeguard the surrounding room in Zone 3, with trolley drapes acting like the ultimate environmental moat against airborne contaminants. It is a completely comprehensive, meticulously designed ring of safety.
Part 3. Inside a premium kit.
All right, let's see how all these individual layers of protection are intelligently bundled into engineered kits to maximize efficiency. Taking a delivery premium kit as our example, you can see how every single layer, from surgeon protection to patient comfort and environmental draping, is precisely curated. But here is the real genius, the packaging. Everything is packed in the exact reverse order that it will be used. This completely transforms the workflow. It turns what could be a frantic scramble for supplies into a smooth, perfectly choreographed dance for the surgical team.
This particular kit contains exactly 13 specialized components. 13. It's not just a random assortment of fabrics thrown in a bag, but a highly specific, layered payload designed to be unpacked in the exact sequence of the surgery. Just imagine the absolute chaos and the dangerous delay if even one of these items was out of order or missing. The surgical team might actually have to break their sterile field, halt the entire procedure, and start over from scratch. Every component has a critical role, and it appears precisely when it's needed.
And that brings us to the most crucial point. This exact curation results in 0 wasted movements. 0. When a patient is on the operating table, literally every single second counts. 0 wasted movements directly translates to minimizing the time a patient spends under heavy anesthesia, which, as we know, is one of the biggest risk factors in any operation. So this level of curation, it isn't just about administrative tidiness. It's about saving those critical, life-altering minutes and significantly improving patient outcomes.
Part 4. Precision for every procedure.
But of course, not every surgery is the same, right? The protective strategy has to shift drastically depending on the specific operation. Think about a heavily physical orthopedic operation, like a joint replacement. That requires very different, much larger materials, like heavy-duty U-drapes and drill saddles to manage flying bone fragments and heavy fluids. Contrast that with, say, a delicate brain or spine surgery, where even a microscopic infection is an immediate disaster. Neurosurgery demands absolute high-barrier personal protective equipment and specialized masks that prevent even the slightest particle emission from the team.
The level of customization across these medical disciplines is honestly staggering. Whether a team is performing complex cardiovascular bypasses that need perfectly tailored adult and pediatric kits with specific fenestrations or openings for accessing the chest cavity, or urology surgery requiring highly specific fluid management waist pouches and hip leggings, the tools absolutely must match the physical demands of the procedure. We aren't just throwing a sterile blanket over a patient here, we're deploying highly specific, technical instruments designed for the unique challenges of that exact surgery.
Part 5. Total Hospital Floor Plan Coverage.
Now that we've looked super closely at the intense microenvironment of the OR, let's zoom all the way out to the macro level. When a hospital implements a unified supply ecosystem, they can seamlessly cover over 10 distinct hospital wings. From the incredibly intense, high-risk environment of the intensive care unit to the delicate, specialized needs of the maternity ward, there cannot be a single gap in safety across the entire floor plan. It's really all about bringing that strict, surgical-level discipline to every single corner of the facility.
This infection and hygiene tier matrix perfectly demonstrates how that unified strategy provides a baseline of safety that is completely scalable. Tier 1 represents your baseline, everyday defense. Think standard patient gowns and face masks used in general wards. But as the risk increases, the system scales up perfectly, all the way up to Tier 3. That tier represents the absolute pinnacle of sterilization prep, using complex wrapping sheets and custom kits. It proves that hospital safety isn't a one-size-fits-all product. It's a dynamic, scalable system that adapts right alongside the level of risk. From the moment a patient is admitted to a general floor, to the second they're under the bright lights in a specialized OR, this ecosystem creates an unbroken chain of sterility. And this chain is vital. If a patient transfers from the general floor to surgery, and the protective protocols don't align perfectly, the chain breaks, introducing massive risk. A consolidated supply chain ensures that unbroken line of continuous, reliable defense, literally no matter where the patient is moved within the hospital.
All of this engineering, logistics, and planning leads us to this vital realization. Medical materials are absolutely not just fabrics, but life-saving armor. Consolidating this supply chain isn't just some administrative convenience for the hospital's purchasing department. It's a profound strategy that directly protects vulnerable patients. And just as importantly, it empowers medical staff. It takes the cognitive load off the doctors and nurses so they can perform at their absolute best without ever second-guessing their tools.
So the next time you think of a modern hospital, ask yourself, do you truly appreciate the invisible daily shield making all of those incredible medical miracles possible? Are we taking this essential, everyday armor for granted? Because without it, modern medicine simply couldn't function. Thank you so much for joining me on today's Explainer. Keep questioning what goes on behind the scenes every single day.